The fluorescent lights of Sacred Heart Medical Center hummed overhead as Emily Parker straightened her crisp white nursing uniform for the third time that morning. At 28 years old, she was the newest member of the emergency department staff, and everyone made sure she knew it. "Rookies here early," Dr. Marcus Chen called out from the nurse's station, not bothering to look up from his coffee. Trying to impress someone, Parker. Emily kept her face neutral as she walked past him to check the supply cabinets. She'd learned over the past 3 months that responding only gave them more ammunition. Sacred Heart was a civilian hospital in Coronado, California, just outside the Naval Amphibious Base. The emergency department saw everything from surfing accidents to training injuries, and the doctors here ran their department like a kingdom. "Did you restock the trauma bay?" Dr. Sarah Mitchell asked, appearing beside Emily with her arms crossed. Dr. Mitchell was the senior attending physician, a woman in her mid-40s with sharp eyes and an even sharper tongue. "I had to hunt for gauze yesterday. That's unacceptable." "I restocked it last night before my shift ended," Emily replied quietly. "Everything should be there." "Should be," Dr. Mitchell's eyebrow arched. "Should be isn't good enough. In this department, things either are or they aren't. Maybe the Navy doesn't teach precision, but here we demand it." Emily felt the familiar sting but didn't let it show. The other nurses had warned her about Dr. Mitchell. The woman had a particular dislike for anyone with military experience, especially those who'd served in combat zones. Emily had spent 4 years as a Navy corpsman attached to a Marine unit in Afghanistan before going to nursing school. She'd seen things these doctors couldn't imagine, treated wounds in conditions they'd never face, made life-or-death decisions with nothing but a medical kit and her training. But here at Sacred Heart, none of that mattered. Here, she was just the rookie nurse who couldn't do anything right. "I'll double-check everything," Emily said, turning toward the trauma bay. "See that you do," Dr. Mitchell snapped. "And next time, don't just restock. Make sure everything is organized exactly according to protocol. Your military habits have no place here." Emily walked into the trauma bay and began checking supplies, even though she knew everything was exactly where it should be. She'd organized it all according to Sacred Heart's protocols, which she'd memorized during her first week. But Dr. Mitchell would find something wrong. She always did. "Don't let them get to you." Emily turned to find Janet Rodriguez, one of the senior nurses, standing in the doorway. Janet was in her 50s, with kind eyes and a no-nonsense demeanor that Emily respected. "I'm fine," Emily said automatically. "No, you're not." Janet walked in and started helping Emily check the equipment. "And you shouldn't have to be. The way they treat you is wrong, Emily. You're one of the best nurses I've ever worked with. Your assessments are thorough, your hands are steady, and you stay calm under pressure. But Mitchell won't see it because of her own issues." "Her son," Emily said quietly. She'd heard the story from other staff members. Dr. Mitchell's son had joined the Marines against her wishes and was killed in Iraq 15 years ago. She'd blamed the military ever since. "That's her burden to carry, not yours," Janet said firmly. "You've done nothing wrong, keep your head up." The morning passed in its usual rhythm. Emily took vitals, started IVs, assisted with procedures, and absorbed criticism from doctors who barely acknowledged her competence. By noon, she was ready for her lunch break. But then the emergency call came in. "Incoming trauma," the announcement crackled over the intercom. "Multiple casualties from training accident at the base. ETA 5 minutes. All hands on deck." The emergency department exploded into controlled chaos. Emily abandoned her lunch and rushed to the trauma bay, pulling on a fresh gown and gloves. Dr. Chen and Dr. Mitchell were already there, along with 2 other physicians and several nurses. "Parker, you stay out of the way," Dr. Mitchell ordered. "We need experienced personnel for this." Emily opened her mouth to protest, then closed it. She'd treated combat casualties in the field. She'd held pressure on severed arteries while under enemy fire, but arguing wouldn't change Dr. Mitchell's mind. The first ambulance arrived, then a second, then a third. Emily watched from the sidelines as the team worked on 3 injured sailors with various broken bones and lacerations. Standard trauma protocol, nothing she hadn't seen before. Then the fourth ambulance arrived. Emily saw the paramedics' faces first. They looked shaken, moving with urgent intensity as they wheeled in the stretcher. The man on it was massive, even lying down. He wore the remnants of tactical gear, now cut away and soaked with blood. His face was gray beneath his tan, and the pressure bandages on his chest were completely saturated. GSW to the chest, possible hemothorax, the lead paramedic reported rapidly. BP dropping 70/40, respiration shallow and rapid. We've got 2 large-bore IVs running wide open. This is Captain James Reeves, Navy SEAL, injured during live-fire training exercise. Dr. Mitchell took one look and started barking orders. Get him into Trauma 1. I need O-negative blood, chest tube tray, and somebody call surgery. Move. Emily's training kicked in before she could think. She saw the signs immediately. The patient's neck veins were distended, his trachea was shifting to the left, and his oxygen saturation was plummeting despite the mask. He had a tension pneumothorax. His lung had collapsed, and air was building up in his chest cavity, compressing his heart and major blood vessels. Without immediate intervention, he would die. He needs decompression now, Emily called out, moving toward the trauma bay. He's got a tension pneumothorax. I said stay out of the way, Parker, Dr. Mitchell shouted. We don't need your combat medicine here. This is a hospital, not a battlefield. But Emily could see what the others couldn't see because they weren't looking. They were so focused on setting up for the chest tube procedure that they missed the immediate crisis. The captain's lips were turning blue. His eyes rolled back. Emily made a choice. She pushed past Dr. Mitchell and grabbed a 14-gauge needle from the supply cart. In one smooth motion, she palpated the captain's second intercostal space, just above the third rib on the right side of his chest. The landmark was exactly where it should be. What do you think you're? Dr. Chen started. Emily inserted the needle with practiced precision. There was a hiss of air as the trapped pressure released. Almost immediately, the captain gasped. His color started to improve. His oxygen saturation began climbing. You just assaulted a patient, Dr. Mitchell screamed. Security, I want this nurse removed from my emergency department immediately. But Emily wasn't looking at Dr. Mitchell. She was watching the monitor, watching the captain's vital signs stabilize. She'd done field decompressions a dozen times in Afghanistan. She knew what tension pneumothorax looked like, and she knew that waiting for the formal chest tube procedure would have been too late. His SATs are coming up, Janet said quietly from her position at the monitor. 85, 90, 94. The captain's eyes fluttered open. For a moment they were unfocused, confused. Then they locked on Emily's face. Something changed in his expression, recognition, perhaps, or understanding. His right hand moved slowly, shakily. With tremendous effort, he brought it up to his forehead in a crisp military salute. The gesture was unmistakable. Every person in that trauma bay saw it. Emily felt tears prick her eyes, but she blinked them back. She returned the salute, her hand steady and sure. Corpsman, the captain whispered through his oxygen mask. His voice was barely audible. I know, my own. Then his eyes closed again, as the sedation from the paramedics took hold. Dr. Mitchell stood frozen, her face white with fury. Get out, she hissed at Emily. You're suspended pending investigation. Security will escort you out of the building. Sarah, wait, Dr. Chen started, but Dr. Mitchell cut him off. Now, Parker, get out now. Emily removed her gloves slowly, her hands steady despite the adrenaline coursing through her veins. She looked at the monitor one more time. The captain's vital signs were stable. He would make it to surgery. He would live. That was all that mattered. She walked out of the trauma bay with her head high, aware of every eye following her. Two security guards appeared at her sides, their expressions apologetic but firm. As they escorted her through the emergency department, Emily heard Janet's voice calling out, 98%. His O2 is 98% and BP is stabilizing. He's ready for the OR. The suspension hit Emily like a physical blow, though she'd expected it. Sacred Heart Medical Center didn't just send her home. They launched a full investigation into what they called unauthorized invasive procedure resulting in patient harm. The irony wasn't lost on Emily. She'd saved Captain Reeves' life, but the hospital was treating her actions as assault. 3 days after the incident, Emily sat in her small apartment, staring at the official letter. The hospital's attorney had written it in cold, clinical language. She was accused of violating hospital protocol, exceeding her scope of practice, and performing a medical procedure without physician authorization. The letter recommended termination and potential reporting to the state nursing board. Her phone rang. It was Janet. "Emily, I'm so sorry," Janet said immediately. "This is ridiculous. Everyone in that trauma bay knows you saved his life. Dr. Chen even admitted it privately." "But not publicly," Emily said quietly. "No, not publicly." Janet's frustration was evident. "Mitchell has them all scared. She's threatening anyone who speaks up for you. She's calling it a breakdown of chain of command, and saying it sets a dangerous precedent if nurses think they can override physician judgment." Emily closed her eyes. "How's the captain?" "That's why I'm calling. He's out of surgery. They removed the bullet, repaired the damage to his lung, and he's stable in ICU. He's going to make it, Emily, because of you." "Has anyone told him what happened? About my suspension?" Janet was quiet for a moment. "I don't know. He's been pretty out of it from the pain medications. But Emily, there's something else. The Navy is asking questions. They sent investigators to review the incident because Captain Reeves is a high-level operator. Some team called DEVGRU or something." Emily's breath caught. DEVGRU, Naval Special Warfare Development Group, the most elite unit in the Navy, commonly known as SEAL Team 6. Captain Reeves wasn't just any SEAL. He was one of the most highly trained special operators in the country. "They've been interviewing everyone," Janet continued. "The paramedics, the nurses, the doctors. They want to know exactly what happened and why. Dr. Mitchell is furious about it, says it's outside interference, but she can't stop them." After they hung up, Emily sat in silence. She'd saved dozens of lives during her deployment. She'd treated Marines with wounds that would have killed them in minutes if she'd waited for authorization or permission. In combat, there was no time for hierarchy or protocol. There was only training, instinct, and the will to keep your people alive. But this wasn't combat. This was a civilian hospital with rules and procedures and doctors who valued their authority more than they valued outcomes. Her phone buzzed with a text from an unknown number. "Ms. Parker, this is Commander William Torres, U.S. Navy JAG. I need to speak with you regarding the incident involving Captain Reeves. Please call me at your earliest convenience." Emily stared at the message. JAG, Judge Advocate General, the Navy's legal corps. She had no idea if this was good or bad, but she knew she had to respond. She called the number. Commander Torres answered on the first ring. "Ms. Parker, thank you for calling back so quickly," he said. His voice was professional but not unfriendly. "I'm conducting an investigation into the circumstances surrounding Captain Reeves' treatment at Sacred Heart. I've reviewed the medical records, the ambulance reports, and I've interviewed the medical staff. I need to hear your account of what happened." Emily took a deep breath and walked him through everything. Her assessment of the captain's condition, her recognition of the tension pneumothorax, her decision to perform the needle decompression, and the aftermath. "You're aware that the hospital has suspended you and is recommending termination?" Torres asked. And you're aware that Dr. Mitchell has filed a formal complaint alleging that you performed an unauthorized procedure that could have killed Captain Reeves. Yes, sir, though the medical evidence shows. The medical evidence shows that you saved his life, Torres interrupted. The surgeon's report states clearly that without immediate decompression, Captain Reeves would have arrested before they could get him to the OR. The paramedics confirmed that his condition was deteriorating rapidly. Your intervention was not only appropriate, it was necessary. Emily felt something loosen in her chest. Then why is the hospital? Politics, Torres said bluntly. Dr. Mitchell has a personal grudge against military personnel. We've discovered that she's been systematically undermining you since you started working there. We have statements from other nurses describing a pattern of harassment and discrimination based on your military service. I never filed a complaint, Emily said. I know, but others noticed. Ms. Parker, I need to ask you something directly. During your time with the Marines in Afghanistan, did you perform similar procedures? Yes, sir. Multiple times. Needle decompression, cricothyrotomy, chest tube placement, emergency amputations, blood transfusions in the field. When you're the only medical personnel available and someone is dying, you do what needs to be done. And you were trained to perform these procedures. Extensively. Navy Corpsman training includes advanced trauma life support. We trained to operate independently because we knew we'd often be the only medical person available to a Marine unit. Torres was quiet for a moment. Ms. Parker, Captain Reeves wants to meet with you. He's aware of what happened, your suspension, and the hospital's actions. He specifically requested that I arrange a meeting. I don't know if that's a good idea, Emily said. I don't want to cause him any stress while he's recovering. The stress is coming from the fact that the person who saved his life is being punished for it, Torres said. He's quite insistent. Would you be willing to come to the hospital? I can arrange access through the naval liaison. Emily agreed, and 2 hours later, she found herself walking back into Sacred Heart Medical Center. But instead of entering through the emergency department, she went through the main entrance with Commander Torres at her side. His uniform and bearing ensured that no one questioned their presence. They took the elevator to the ICU. Emily's heart pounded as they approached Captain Reeves' room. Through the window, she could see him propped up in bed, his chest wrapped in bandages, various monitors tracking his vital signs. Torres knocked softly and opened the door. Captain, Ms. Parker is here. The man in the bed looked different than he had in the trauma bay. His color was better, his breathing steady with the help of oxygen through a nasal cannula. His eyes were clear and focused as they locked on Emily. Corpsman, he said, his voice rough but strong. Come in, please. Emily walked to his bedside, suddenly unsure what to say. This was a legendary SEAL captain, a warrior who'd led countless missions, saved countless lives, and he was calling her Corpsman, the highest term of respect in the military medical world. Sir, you saved my life, Reeves said, cutting her off. The surgeons told me. Tension pneumothorax, right? You did a needle decompression before they could set up for the chest tube. Yes, sir. And now they're trying to fire you for it. It wasn't a question. His jaw tightened. Commander Torres has filled me in on everything. The harassment, the suspension, the investigation, all because you did your job. I violated hospital protocol, sir. I performed a procedure without physician authorization. Reeves' eyes flashed. You performed a life-saving intervention on a dying patient. That's not a violation, that's excellence. How many field decompressions did you do downrange? 14, sir, all successful. Unit 3rd Battalion, 5th Marines. I was with Kilo Company for 2 deployments. Reeves nodded slowly, a look of recognition and respect crossing his face. The Dark Horse Battalion. I worked with your Marines in Sangin, some of the toughest fighting of the war. You were there for that. Yes, sir. Second deployment, 2010 to 2011. Then you saw the worst of it. He shook his head. Korsman, you saved lives under fire. You made impossible decisions with limited resources. And now some doctor who's never seen a day of combat is trying to end your career because you had the courage to do what needed to be done. It's more complicated than that, sir. No, it's not, Reeves said flatly. It's exactly that simple, doctor. Mitchell has a personal problem with the military and she's taking it out on you. That's not complicated, that's wrong. He looked at Commander Tors. What are our options? Tors opened his briefcase and pulled out several documents. I've completed my investigation. The evidence is clear that Ms. Parker's actions were medically appropriate and life-saving. I'm recommending that the Navy file a formal complaint against Sacred Heart for discriminatory practices and wrongful termination. We also have grounds for a lawsuit on Ms. Parker's behalf. I don't want revenge, Emily said quickly. I just want to do my job. I just want to help people. And you should be able to do that without being punished for excellence, Reeves said. He tried to sit up straighter and winced. Emily instinctively moved to help him, adjusting his pillows and checking the angle of his bed. Still taking care of patients, he observed with a slight smile, even when they've caused you nothing but trouble. You didn't cause me any trouble, sir. You were injured, I helped. That's what I'm supposed to do. Reeves looked at Tors. I want to make a statement. I want it on record that Korsman Parker saved my life, and that any action taken against her is a direct attack on the standards of medical care. I also want to speak with the hospital administrator and Dr. Mitchell personally. Captain, you need to focus on recovering, Emily protested. I am recovering, thanks to you. His expression turned serious. Listen to me, Korsman. I've led men and women into combat for 20 years. I've seen courage in many forms. What you did in that trauma bay was courage. You knew you'd face consequences, but you did it anyway because it was right. That's the definition of heroism. Emily felt tears threatening again. I was just doing my job, sir. Exactly, and they're trying to destroy you for it. That's not something I can let stand. He looked between Emily and Tors. We fight for our own, always. You saved my life. Now let me help save your career. Before Emily could respond, there was a knock at the door. A hospital administrator entered, followed by Dr. Mitchell. The administrator, a nervous-looking man named Gerald Thornton, glanced between the three of them with obvious discomfort. Captain Reeves, I didn't realize you had visitors, Thornton said. Dr. Mitchell and I came to check on your condition and discuss your ongoing care. Perfect timing, Reeves said, his voice taking on a harder edge. I have some things to discuss with you as well. Dr. Mitchell's eyes landed on Emily and her expression turned to ice. What is she doing here? She's suspended. She has no authorization to be in this hospital. She's here at my request, Reeves said coldly. As is Commander Tors, who represents the Judge Advocate General's office. We have questions about Sacred Heart's treatment of the person who saved my life. The tension in Captain Reeves' hospital room was thick enough to cut with a scalpel. Dr. Mitchell stood rigid near the door, her face flushed with anger. Gerald Thornton, the hospital administrator, shifted uncomfortably from foot to foot, clearly wishing he was anywhere else. Captain Reeves, I understand you're grateful to Ms. Parker, Thornton began carefully, but there are protocols we must follow. She performed an invasive procedure without authorization. We simply cannot. Cannot what? Reeves interrupted. Cannot allow your nurses to save lives. Cannot tolerate competent medical care. He looked at Commander Tors. Tell them what you found. Tors opened a folder and began reading in a calm, authoritative voice. Over the past 3 months, Ms. Emily Parker has been subjected to a documented pattern of harassment and discrimination by Dr. Sarah Mitchell. This includes excessive criticism for minor or non-existent errors, assignment to undesirable shifts, exclusion from educational opportunities, and public humiliation in front of colleagues and patients. Additionally, 7 other staff members have provided statements indicating that Dr. Mitchell has repeatedly made derogatory comments about military personnel and specifically targeted Ms. Parker due to her service as a Navy corpsman. Dr. Mitchell's face went from red to white. That's absurd. I hold all my staff to the same high standards. Really? Torres continued. Because we also have your son's name, Connor Mitchell, Marine Lance Corporal, killed in action in Fallujah 2006. We have records showing that since his death, you've demonstrated hostility toward anyone with military service. This isn't about standards, Dr. Mitchell. This is personal. The room fell silent. Dr. Mitchell's hands trembled slightly, but her voice remained hard. My son has nothing to do with this. This is about a nurse who violated protocol and endangered a patient. I'm the patient, Reeves said, his voice cutting through the tension like a blade. And I'm telling you that she saved my life. The surgical report confirms it. The paramedics confirm it. The medical evidence confirms it. The only person who doesn't seem to understand that is you. You don't understand how hospitals work, Dr. Mitchell shot back. We have hierarchies for a reason. We have protocols to prevent chaos. If every nurse thinks they can override physician judgment. I wasn't overriding judgment, Emily spoke up for the first time, her voice steady. I was providing emergency care for a life-threatening condition. You were setting up for a chest tube, which was the correct definitive treatment. But he didn't have time to wait. He was dying. In the field, we call that the golden hour, the critical window where immediate intervention means the difference between life and death. This isn't a battlefield, Dr. Mitchell snapped. No, but emergency medicine is still emergency medicine, Emily replied. The principles don't change just because we're in a hospital instead of a combat zone. Airway, breathing, circulation, the ABCs. He couldn't breathe because his lung was collapsed and the pressure was crushing his heart and major vessels. That's not a protocol situation. That's a right-now situation. You should have called for a physician. There were 2 physicians in the room, Emily interrupted, both preparing for the chest tube procedure, neither recognizing the immediate crisis. I made the call because I had the training and experience to recognize what was happening. Thornton cleared his throat. Dr. Mitchell, perhaps we should consider. Consider what? Allowing nurses to assault patients. Dr. Mitchell's voice rose. She stuck a needle into his chest without authorization. She performed a needle thoracostomy to relieve a tension pneumothorax, Commander Torres said sharply. A procedure she was trained to perform independently as a combat medic. A procedure that the medical evidence shows was absolutely necessary. And now you want to punish her for it because it makes you feel like you lost control. How dare you? How dare I? Torres stepped forward. Dr. Mitchell, I've reviewed dozens of cases. I've seen the pattern. Every military veteran who has worked in your department has either quit or been forced out. You've created a hostile work environment based on your personal prejudice. That's not just wrong, it's illegal. The hospital administrator looked like he might be sick. Commander, I assure you that Sacred Heart does not tolerate discrimination. Then why has it continued for years? Torres demanded. Why has no one stopped it? Why is the nurse who saved a patient's life being suspended, while the doctor who created a toxic work environment still has her job? Dr. Mitchell's composure finally cracked. You don't understand. None of you understand what it's like. My son, her voice broke. My son was 19 years old. He believed all the propaganda about duty and honor and serving his country. They sent him to that godforsaken desert and he came home in a box. The raw pain in her voice filled the room. For a moment, no one spoke. I'm sorry for your loss, Emily said quietly. I truly am. I saw Marines die in Afghanistan. I held their hands as they took their last breaths. I wrote letters to their mothers trying to explain that their deaths meant something, and every one of those deaths broke something inside me. Dr. Mitchell looked at her with eyes full of tears and fury. "But your son's death doesn't give you the right to punish me for surviving," Emily continued, her voice gentle but firm. "It doesn't give you the right to take your pain out on every veteran who walks through that door. And it doesn't give you the right to let your grief interfere with patient care." "I would never," Dr. Mitchell started. "But you did," Captain Reeves said. "Your hatred of the military was so strong that when a patient needed help, you were more concerned with authority than with saving a life. You were so focused on putting the rookie nurse in her place that you didn't see what she saw. And if she hadn't had the courage to act despite your hostility, I'd be dead right now." Thornton wiped his forehead with a handkerchief. "Captain Reeves, Dr. Mitchell, perhaps we should all take a step back. This is clearly an emotional situation." "Emotional?" Reeves' voice was hard as steel. "Mr. Thornton, let me make something very clear. I am Captain James Reeves, and my unit operates at the highest levels of national security. The Navy has a vested interest in my survival and in the quality of care I receive. If this hospital continues to employ a physician who allows personal prejudice to compromise patient care, and if this hospital continues to punish a nurse for providing excellent emergency medicine, then I will personally ensure that not a single service member from the naval base ever steps foot in Sacred Heart again." Thornton's eyes widened. "Captain, you can't." "I can and I will. Do you have any idea how much of your emergency department's volume comes from the base? Training accidents, routine emergencies, dependent care. You'll lose millions in revenue. And that's just the start. I'll make sure every military family in Southern California knows that Sacred Heart discriminates against veterans and punishes excellence." "This is blackmail," Dr. Mitchell said. "No," Torres corrected. "This is consequences. You've created a situation that threatens both patient care and the professional well-being of a decorated veteran. The Navy won't stand for it. Neither will I." Thornton looked between them all, clearly calculating. Finally, he turned to Dr. Mitchell. "Sarah, I think you should take a leave of absence, paid leave, to give us time to sort this out." "What?" Dr. Mitchell looked betrayed. "Gerald, I've worked here for 15 years. "And you've done excellent work," Thornton said quickly. "But the allegations are serious. We need to conduct a proper investigation. In the meantime, it would be best if you stepped back." Dr. Mitchell stared at him, then at Emily, then at Captain Reeves. "This isn't over," she said quietly and walked out of the room. After she left, Thornton turned to Emily. "Ms. Parker, your suspension is lifted effective immediately. I apologize for the distress this has caused. We'll be conducting a full review of department policies and practices." "And her personnel file?" Torres asked. "This incident won't be documented as a disciplinary action. It will be documented as a life-saving intervention performed under emergency conditions," Thornton said. "Is that acceptable?" Emily nodded, still processing everything that had just happened. After Thornton left, Emily turned to Captain Reeves. "Sir, you didn't have to do that. You shouldn't have put yourself under stress while you're recovering." "Stop," Reeves said, holding up a hand. "Corpsman, you need to understand something. In my world, we don't leave anyone behind. We don't let our people suffer because someone else has a problem. You saved my life. That makes you one of my people, and I take care of my people. But your career, the threat about the hospital, wasn't a threat. It was a promise." Reeves settled back against his pillows. "Sacred Heart needs to understand that excellence matters more than ego. They needed to understand that you don't punish someone for doing the right thing." Commander Torres packed up his briefcase. "Ms. Parker, I'll be monitoring the situation. If you experience any retaliation or further harassment, you contact me immediately. Understood?" "Yes, sir. Thank you, sir." After Torres left, Emily stood awkwardly by Captain Reeves' bed. "I should let you rest." "Sit down for a minute," he said, gesturing to the chair beside his bed. "I want to tell you something." Emily sat. "When I was on that stretcher in the ambulance, I knew I was dying," Reeves said. "I've been injured before and I know what it feels like when things are going wrong. I could feel my chest getting tighter, my breathing getting harder. I thought about my wife, my kids, all the things I'd never get to do." He paused. "Then I heard your voice in the trauma bay. You sounded so calm, so certain. And when you acted, I felt the pressure release. I felt like I could breathe again. In that moment, I knew I was going to live." Emily felt tears on her cheeks. "When I saluted you, it wasn't just gratitude," Reeves continued. "It was recognition, one warrior to another, one person who's seen death and fought against it to another person who does the same thing. That salute meant, I see you, I know what you are, I know what you've done, and I honor it." "Sir," Emily's voice broke. "You don't have to call me sir," Reeves said with a slight smile. "We're not in the chain of command, but I need you to promise me something." "Anything." "Don't let them break you. Don't let anyone make you doubt what you know to be true. You're an exceptional nurse and you were an exceptional corpsman. You have a gift for seeing what others miss and the courage to act on it. The world needs people like you. Don't let anyone take that away." Emily nodded, unable to speak. Over the following weeks, Sacred Heart Medical Center underwent significant changes. Dr. Mitchell took an extended leave of absence and eventually resigned. An independent review of the emergency department revealed numerous issues with staff treatment and patient care protocols. New policies were implemented to protect nurses who made emergency clinical decisions. Emily returned to work and found a different atmosphere. Dr. Chen apologized publicly for not standing up for her. Janet and the other nurses welcomed her back as a hero. New staff members treated her with respect, and word spread throughout the hospital about the nurse who'd saved the SEAL captain's life. 3 months after the incident, Captain Reeves returned to Sacred Heart for a follow-up appointment. He was fully recovered, back to full duty with his SEAL team. He walked into the emergency department in his uniform and asked for Emily. When she came out to the lobby, he was standing there with his wife and 2 teenage daughters. "Corpsman Parker," he said formally, "I'd like you to meet my family. Sarah, Emma, and Claire, this is the nurse I told you about, the one who saved my life." His wife hugged Emily tightly. "Thank you," she whispered. "Thank you for bringing him home to us." His daughters hugged her too, both of them crying. Later, after his family had gone to get coffee, Captain Reeves handed Emily a small box. "What's this?" she asked. "Open it." Inside was a challenge coin, a custom-made medallion with the SEAL trident on one side and an inscription on the other. "Courage under fire, Corpsman Emily Parker, a true warrior." "Captain Reeves, I can't." "You can and you will," he said firmly. "This coin represents something important. It means you're part of the Brotherhood. Any SEAL who sees this coin will know what it means. It means you're one of us. It means you've proven yourself under fire. It means you're trusted." Emily closed her fingers around the coin, feeling its weight. "There's something else," Reeves said. "I've been talking to people. There's a position opening up at the Naval Medical Center San Diego. They need experienced nurses with combat medicine backgrounds. The pay is better, the respect is there, and you'd be working with people who understand what you bring to the table. If you're interested, I can make some calls." Emily thought about Sacred Heart, about the changes that had happened, about the respect she'd finally earned. But she also thought about working with people who understood, who'd been downrange, who knew what it meant to make impossible decisions under pressure. "I'm interested," she said. 6 months later, Emily stood in her new uniform at the Naval Medical Center. She was the senior nurse in the emergency department, mentoring young corpsmen and teaching the next generation of military medical personnel. She worked alongside doctors who respected her experience and valued her judgment. On her first day, she'd mounted Captain Reeves' challenge coin in a small frame on her desk. It reminded her of what she'd learned, that courage means doing the right thing even when it costs you, that excellence speaks louder than rank, and that true warriors recognize each other regardless of the uniform they wear. And when young corpsmen came to her with questions or doubts, when they struggled with the weight of responsibility or the fear of making mistakes, she would tell them about a day in a civilian emergency room when she'd had to choose between following orders and saving a life. Trust your training, she would tell them. Trust your instincts, and never let anyone make you doubt your worth or your capabilities, because when it matters most, when someone's life hangs in the balance, courage and competence are all that count. The story of the rookie nurse who'd been mocked and dismissed, who'd saved a SEAL captain's life and stood up for what was right, became part of the culture at the Naval Medical Center. It became a reminder that sometimes the people others underestimate are exactly the ones who rise to meet the moment. And Emily Parker, combat corpsman and warrior nurse, continued to save lives and mentor the next generation, proving every single day that true strength comes not from never being knocked down, but from always getting back up and continuing the mission.